I have a lot of doctors that will approach me and say, BJ, I just don't like conflict.
Mm-hmm.
And I'll say, oh, but there's conflict resolution.
Welcome to the Dental Construction Insider, your go-to place for anything dental construction, whether it's a startup, it's a remodel, it's an expansion, or it's the big ground up. Boom.
Make sure and like us, subscribe, and if you have any comments, leave them down at the bottom.
Yes. So I'm here with Veronica as normal.
Co-host.
Co-host Veronica. She's with us today. She wasn't with us a couple of days ago or whatever, I think. The last podcast, whatever. And we have a special guest. We have BJ, who's behind the scenes and does our HR and all of our compliance and stuff because we are in construction, so we're always out of compliance. And we're always not following HR, so she keeps us in check. Barb, welcome to the podcast.
Thanks for having me.
Well, we're happy to have you. We always get these questions during, the startup process with different clients asking us, like, what should I be doing right now? Or is there something I'm like, construction-wise, we always have these checklists that we follow for them to, like, order your tip-up bends or tackle boxes or order any decorative materials you're buying. But then they're like, no, do we have, like, any business stuff we should be doing? I'm like, well, you shouldn't be asking us. But, let me put you in touch with BJ. Maybe she can kind of tell you what, you should be doing if they don't have like a startup person that's helping them do all that kind of stuff. Mm-hmm. So, for everybody to know, BJ is the one that got me into the program many years ago. So I have her to thank for getting me into this dental world industry. Thank you again. And believing in me and trusting me. And so it's much appreciated. BJ Toudouze is here to talk about HR and just the different things you should be doing at your startup. Like, what should I be doing right now? Well, let's ask BJ. So let me give you a scenario. We're like just, breaking ground, starting the underground portion of their job, their project, and it's going to be, from there it should be roughly 120 days. Which is 3-4 months roughly before we're going to turn it over. So when we start construction, what should they be doing?
First of all, the most important thing that they should be honing in on and that should be really tight, rather than what I like to say, look beyond your nose but not too far down the road. However, it's really important at this point in the process to be creating their handbook. The handbook is the everything, the go-to, their Bible that will take them down the path of the next step. But most importantly, it begins with the mission statement. I highly recommend that you do not create your own a manual simply because...
So don't ChatGPT a handbook?
No, do not do that. No.
Okay. A big liability.
That's a big no-no. But the main thing is to create this handbook with someone holding your hand, preferably, and I always reach out to an attorney.
Oh.
And I have someone that is very good at creating handbooks for the dental world, so dental specific. Yeah. They are very, very honed in on what needs to be placed in the handbook. They will guide you every step of the way, and I've created, I passed 138 handbooks a long time ago, and so I just stopped counting.
Yeah.
But anyhow, they're very good at it, and if you want the name, I can always go ahead and give you that.
Okay, cool. Well, that's good to know.
Yeah.
So let's right there. If y'all have any questions, just reach out to BJ, and she has I think it's BJ at 26 Dental Builders.
26L Dental
26L Dental Builders. I don't even know my own website. Yeah,
that's
right. Reach out to us and we can give you her.
We can put you in contact.
Yeah, we give you her information. So yeah, that's good. So like the handbook, and I'm sure that takes time.
It does take time.
Right.
It takes time to create, but it is the most important piece that of the entire puzzle that you need. Yes, as you know, in construction, you're going to be placing so many things of necessity in the area, and of course, you must be compliant, which is where I come in. But most importantly, the handbook has to be created. From this, it will guide you for every aspect of the business. So, just I can't overstate that.
Okay.
Now, having said that, go ahead with your question.
Yeah, so it's so the handbook would be the most important. And then I guess there's like, and does that fall into like the HR part of like hiring people or?
Right. So, one of the hats that I wear, that's the main hat, and what I like to call, I'm a sausage maker. So, I do the behind the scenes things, but it is the structure of the business that's most important, and those things are things that are mitigated. Of course, we talked about compliance, but HR, risk management. Risk management is huge. That involves, of course, OSHA, safety, and for the practice as well as your patients that are going to be walking through the door. So
Yeah.
this needs to be beginning 3 months prior to
wow.
opening. And actually, I would highly suggest that you do it even sooner. It can be done at 3 months. However, your shoulder is against the wheel, so you need to go ahead and get that done.
So we've had, we in just conversations with docs when we're, getting ready to turn their office open, turn it over. We've told them like, hey, how's the hiring process going and stuff. We're like, 30 days or less. And they'll tell us, oh yeah, I'm going to start interviewing soon. I guess I need to get that done. I'm like, Doc, we're turning this over to you in 30 days or less, for sure. And, it just happens to be something I'll ask him. Like, we're small talking. I'm like, hey, I'm walking around doing my checklist, looking, just checking things. And then I'll ask him, like, how's the hiring process going? Because I know that's not very fun. And they'll say, like, like I said, oh, we're, hey, yeah, I'm going to start that soon. I'm like, ooh. And I don't say anything, but I'm like, yeah, you probably should start that. Because it's not just a matter of, putting an ad out or, we see the commercials all the time, right?
Right.
There's these, there's what, Indeed, there's Recruiter.com, there's the old-fashioned LinkedIn, which I know a lot of people use, which is still good.
Yes.
If you're maintaining your LinkedIn, then that means that you take pride in what you do, I know. I think I've seen Craigslist.
There's Craigslist. I don't recommend it, but
Yeah,
there is
I
that.
know.
There is that, and sometimes it does work in certain demographics, so
Yeah.
that is good. There's Dental Post.
Dental
There's,
Post.
but what I really think that there are many offices that don't take advantage of the opportunities of the resources that are readily at hand, which are the dental facilities that are educating these individuals.
Oh.
So the dental school that's educating the hygienists, the dental schools that are educating the RDAs. There's just a myriad of allied health that you can tap into, and why not?
Yeah.
They need a job. You can also gain, and I can come back to this, but you can gain their learning expertise early on in the game because they need between 70 and 80 hours prior to completing their certification of RDA, RDH, the lab techs. So, and why not utilize that? And the thing of it is that, yes, you do need to reach out to the schools, and you do need to go ahead and confirm that you're a legitimate business that is practicing under the guidelines of whatever state that you're in. However, there's a great resource there. So you need an extra pair of hands. They need some experience. Why not use that? Now, when it comes to you need a certified individual, that's something that's different. However, you can still get a new graduate. Why not get a brand new graduate? They don't have any bad habits, that you have to undo.
Yeah, that's true. That's
So
true.
why not go ahead and utilize that?
Yeah.
There are times where, you need somebody, you're not exactly sure if you need one hygienist or 1.5 hygienists or 1.5 RDAs, but you can still tap into that by going ahead and utilizing a temp agency, or really just making a great relationship and a connection with the schools that are educating these individuals.
Yeah. So, would you say? So just to clarify for the audience, would you say that they need to that 30, like less than 30 days for hiring somebody is okay, or should they start that process sooner, interviewing sooner?
I would begin interviewing sooner. I would begin interviewing at 45 days to 50. And even if you could do sooner than that, simply because it is not just a one and done. It's sometimes 3 and 4 interviews.
Oh yeah.
Also,
That's true.
you want to let them know ahead of time that you are under construction, that you will be opening the office. There are many individuals that are looking for a place to work in, close to their homes,
Yeah.
in and around their normal path, rather than driving so far. Now, there are some that are willing to drive 45 minutes to an
Yeah.
hour, which, oh, that's great.
Yeah.
But I start very early on, and that way then I know where
Yeah.
I am in the process.
We've seen some docs bring, we have seen them bring some, like, we've run into them at the office when we're doing our site visits.
Yeah.
And they're bringing, an assistant or front office person through to, like, give them a tour, like, hey, this is where this can be. They're kind of bringing them through. And typically, they don't know if they're hiring them or not, but they're just kind of bringing them to kind of entice them, like, hey, we got a brand new office. This is what it's going to look like. It's very unique. And I don't, whether they pan out or not, I don't know, because I don't ever really, we got turnover and,
That's, yeah.
boxes are flying and materials and things are being put away and stuff is going. So, we don't really ever see if they've made the cut or not. But I know that I've told them, like, yeah, you all really should start that process a little bit sooner. So that got me thinking about something else. So RDAs are registered dental assistants.
Correct.
Okay, and are they allowed to go, like, reciprocal from different states, like Texas to Louisiana, Louisiana to Florida, or west? Or is it
Well,
only specific for that state?
it depends on the mandates that
Oh, okay.
are by the state. So that is a very good question. When I'm usually in an area, wherever it may be, it could be, I'll say Timbuktu, because
Yeah.
I've been all over.
Yeah.
But I always check the mandates. Typically, they're registered to practice in that state. Now,
Okay.
that does not mean that they are, when they're relocating, that they're not able to be certified in the state over, 3 states over. Now, where you're going to have issues are typically California, Massachusetts, New Jersey. Those are just,
Yeah,
that's just the way it is.
that's the way it is. So yeah, I know.
For a lot of things.
Well, yeah.
So, what do you have to say to those that want to hire people that they're working with right now?
Oh, so they want to poach.
Yes.
Okay.
What's
So-
behind that?
So that is typically not a great idea,
Yeah.
as we know. That's disrespectful to their current employer.
And there's
And
penalties,
and there's
right?
penalties
Yeah.
for that. Yeah, there can be, and quite steep. However, having said that, they are free to leave. They are free to get up and relocate. But having said that, I would be very, very straightforward with the employer. There is not a good idea to hide this, to try to shield themselves from any sort of conflict. Which brings me to a point. I have a lot of doctors that will approach me and say, BJ, I just don't like conflict. And I'll say, oh, but there's conflict resolution. And it's wonderful. So send me that conflict. Give me those questions and let me walk you down the path of resolving this situation, this issue, this sensitive topic, and we can go ahead and work through that. But anyway, yeah, it's...
Well, yeah,
It's a
and
good
normally
idea.
if you don't just handle the conflict early on, then it just
Right.
snowballs into something bigger. And that's when I remember seeing you when we, worked at the DSO.
Yes.
You were, your office was like, it was always somebody coming in for something, and it was just, you were
Sure.
always trying to get ahead of the biggest priority because, even, we learned that even in our world of construction that, something's going to come up, an inspector or somebody wants something, and just, kicking the can down the road is only making it worse or making it more expensive or making it more painful. None of us really like conflict, but it's just part of life. It's part of what we have to deal with. And, once we
Right.
had it on. And so I remember you would, I was like, man, I'm glad
It takes a special person for that kind of job.
to just listen to, some,
lot of
some stuff that
patience.
you have to listen to. And you need that
Yes.
person to be able to do that and filter that out and find out what the root
Cause
issue or cause or whatever it may be. And that's like right up your alley, just, being able to do that. So,
Yeah, and that is so important what you mentioned there because there's so many individuals that will come into my office, and they have a concern that could have been mitigated so much earlier on, and not in particular by myself.
yeah.
That's not when it should have been done. When it comes to my door, then it's a sound issue. However, most of the time, listening resolves it. They just want to be
want
heard.
to
should be
heard,
another.
like-
I wanted to go back to the poaching.
Yes. Okay.
Okay. Go ahead.
It's to me, it's like if they're doing it to this employee, what makes you think that they won't do it to you once you're established?
That's precisely why they're chasing the buck.
Yeah.
So, and they're chasing a dream that really, in all reality, isn't there, because they're bringing what they have in their mindset to the practice. So, whatever it is, I've kind of likened it to a separation or a divorce. Whatever happened in the first instance, the two individuals that are in a relationship are still going to take it with them,
Right.
unless they go ahead and try to resolve the issue, at the root cause. So with those people that are poaching or that are wanting to go to the next new big dream,
Oh, yeah.
or the next shiny
Office.
lure, I call it, then it's just they need to check themselves and find out what it is. And I highly recommend, yes, using paper and pen. Do not type it on your computer. Use a paper and pen and put a pros and cons list out there. And then there's a third column that says, what am I bringing to the practice? What am I bringing? Am I bringing what kind of attitude? Am I bringing empathy? Am I bringing initiative?
Yeah.
What is it I'm bringing?
Yeah. And a lot of offices have where you really can't poach.
Right.
You can't, bring your friend that's
Right.
an assistant or whatever, or they have that written in there, or
Oh,
they have a
yeah.
dollar amount with them, and
Right.
so, but
And-
they do it anyway.
Yeah. Ultimately, they can, and they can make a reason why, and really, it's none of our business.
Yeah.
And in all reality, if they do want to leave, why would you want to make them stay?
Mm-hmm.
Because they're not happy.
Right.
So let them go and
Yeah.
wish them luck. And always, at separation, leave them with their dignity.
Mhm.
That's just common respect.
Yeah. Wow.
To close this out, do you have any horror stories or interesting hiring stories?
Gosh, interesting hiring stories. I have so many. But I can remember renting 2 ballrooms in Dallas-Fort Worth, Marriott by the airport, and interviewing over 500 staff.
That's crazy.
And it was
That's a lot.
it was very interesting. And I was interviewing for providers. So for my doctors, I was interviewing RDH, so registered dental hygienist and assistants, and then also the remainder of the allied. So I do front office, so for admin, and then clinical staff. And that was quite interesting. I don't know if you want to save it till the next one, but the compliance part of it,
Oh, yeah,
because there's a
that'll
whole
be-
lot of compliance
Oh, okay,
involved
yeah.
in that issue.
Yeah.
So,
Oh,
folks, if y'all have any questions, comments, concerns,
Yep.
let us know. We don't mind sharing.
All right. Well, thanks for joining us, and we will continue this conversation.
Yep.
Great, thank you.
Right.
Here's your
good.
Oh, yes.